imitation. They like to imitate cartoons, right? Facial expressions. Facial expressions. Children like to make faces. The point of this is your patient has a face. They have a face of pain. Look at their face. They will give you an idea of how much pain they have. Just from the expression of their looks on their face, you can determine how much pain they are. You can also determine whether or not they are depressed. Depression is also an expression. Usually it's just no expression at all. You know, a very sad look to their face. Perhaps they need more medical attention than you can give. You might have to send them to the psychiatrist, right? The psychology department to get some counseling. And then they can come back to you. Or concurrently, you can do it together with a doctor. There's no reason why you can't work with another doctor at the same time while you are giving treatment and they're getting treatment with another doctor. You're both doing different things. Helping the patient still is your goal. How long have you had this pain? You should ask this question, how long? Oh, it happened yesterday. It could have happened today. It started last week. It started last month. And believe it or not, you have some patients who will come to you and say, it happened last year. They will wait and wait and wait. They don't want to go to the hospital. They don't want to go to the doctor. They're determined not to go. But eventually, they give up and say, I have to go to the doctor. I can't stand it no more. Too much pain. It affects your mind. Well, technically, they've done some research, and they claim that most people cannot handle pain for more than 3 months. In fact, well, I mean, not. What they mean is they'll break down eventually and say, I got to do something about it. You know, after 3 months, they start having psychological problems because of the pain they're enduring. Okay? Can you describe the pain? A description of the pain. Is it like a knife? Very sharp? Is it a sharp feeling? Does it feel like it's there now and later it comes back, it disappears? Is it like a dull pain? I can just barely feel it, but I know it's there. Does your skin feel hot? Does it feel cold? Hot usually is like an indication of swellingness, inflammation. It may not appear, it may not look swollen, but it feels hot. It is swollen, most likely. Does it feel cold? Is there a decrease in circulation occurring? Does it feel like a stinging feeling, like a bumblebee? Zzz, ouch! Does it feel like it's burning sensation? Or does it feel like it's radiating or shooting? In this case, the pain starts here and the pain goes all the way down. Radiation, shooting. Boom, boom, boom. Right? Shooting pain. There's all kinds of descriptions. Okay? Just like there's as many words there are in the languages, there are different descriptions of pain. Each patient will say something different. You should know these two words, acute and chronic. You should know this. These are important. Acute usually means a new injury, or it means an early injury. Chronic is something that's been around for a while. It's an old injury. It's a recurring thing. It never goes away more likely. It becomes a permanent situation maybe. Chronic. Like for instance, if I was walking and I fell down today, my back will start to hurt. The doctor will say, you have acute low back pain. That is your diagnosis. This is the title of what you have. If you fall down and then 6 months later you go to the doctor and the doctor says, when did this accident happen? You say 6 months, then your doctor will call it chronic low back pain. That's his diagnosis. So that's why it's important to ask when. When did this happen? Because it will help you diagnose, give it a name on paper. Getting an idea of the history. How did it happen? Did it happen at work? Was this a car accident? Were you going down the stairs and you slip? Okay? It's important to know how it happened as well, the history behind it. When does the pain feel worse? If I tell you my left knee, I have a lot of left knee pain, then most likely I will tell you when I go to work, walking, when I go up the stairs, it hurts. So whenever I'm moving, it hurts me. Okay? When I am asleep, it hurts me. Your patient tells you they're asleep and they wake up because they feel the pain. Not a good indication. Not a good response. What will happen is that the patient will not only have his left knee irritating all day long, but he feels tired because he didn't get any sleep. So now we have added stress to his world. We have to do something about the pain so he can get some sleep, so he can continue working and continue doing his daily activities. When he drives the car, maybe his wrist is hurting, his shoulder is hurting, his arm is hurting. When he's driving, he irritates it. Maybe he's a truck driver. You know, that would make sense, you know. He's been a truck driver for 20 years, and now he's starting to have shoulder problems, right? He can't quit his work. That's the only thing he knows. You have to do something about it. We have to help him. We have to give him some therapy. When is the pain the worst? When I have a lot of stress. Stress is always a factor. Stress cannot be eliminated. It is always here. Always here. Even if you're rich, with a lot of money, with a lot of cars, a lot of homes, you still have stress. No matter what you do, it's not going away. I feel pain after I'm working on my computer. If your patient says I have neck pain, well, it makes sense to me that you have neck pain and you're working on the computer all day. What happens? They work on the computer all day like this, and when they finish, they go to lunch. Now they come back to lunch, from lunch, go back to work. This is why they have neck problems. They have neck problems because they do this all day. Yeah, how can I help you? How can I help you? How can I help you? That neck problem, back and forth. That's why I tell my patients, You need to bring the computer up so you can look straight and you can type. It's okay to stand up all day. You'll lose more calories. Okay? You won't get heavy. You can exercise in place. You know, you can have fun. Because if you sit down all day, you'll come to see me because you have low back pain. I don't want you to come to